It's been almost a year since India Johnson was arrested for the stabbing death of her mother in Virginia Beach. Earlier this month, she pleaded guilty by reason of insanity.
A judge agreed Johnson could not be criminally responsible. Now her case is in the hands of the Virginia Department of Behavioral and Developmental Services. She'll be evaluated and either released or stay in state custody.
Now, if she is ordered to remain in state custody, she'll be sent to a state hospital. Now, one possibility is Eastern State Hospital, which recently lost some of its funding. 10 on your side's Matt Gregory has been looking into what this means. He is live in our newsroom now with details. Matt?
Yeah, earlier this month, the federal government told Eastern State they failed to qualify for Medicare funding. The facility in Williamsburg sees all sorts of patients with mental health issues, including some high-profile cases. Now, with the loss of funding, the Commonwealth of Virginia says they will step in to bring the mental health facility up to code. This month, when a Virginia Beach judge ruled that India Johnson could not be criminally responsible when she stabbed her mother to death in the summer of 2015, one of her possible sentences meant going to the Eastern State Hospital. That same hospital this month received a letter of termination of its Medicare funding from the federal government.
Treatment planning and nursing interventions in particular, and also patient engagement in treatment. It was those three areas that, although some progress was made, it was not sufficient for the federal standards.
The Assistant Commissioner for Virginia Behavioral Services says the new laws on mental health have weighed down the facility.
For example, they have experienced a 400% increase in the number of temporary detention orders that are admitted to their hospital.
Overloaded and overburdened, according to the state. We asked the Assistant Commissioner if they've lost faith in the people in charge of the facility.
I have complete confidence that in the administration.
It's a loss of around $700,000 in funding. Her says the state will fill the gap, then move forward to reapply for Medicare funding.
We have also paid for a nationally recognized consultants to come in and DMS survey to conduct their own review and help us develop a plan of action to move forward so that we can meet those standards and request recertification.
Hurd told me he believes there will be no loss of service for the patients, but they do not have a timeline yet for correcting the issue. In the newsroom, Matt Gregory, 10 on your side.